Welcome to Doctor Health Hub, where every episode begins with a doctor tip you can trust. Today, let's talk about something many people feel, but almost no one wants to talk about. Bloating, cramps, running to the toilet, or sitting there stuck. Maybe someone told you it's just IBS. So what is IBS really? Is it dangerous? And when should you worry?
Stay with us. We will keep it simple, calm, and clear. By the end, you will understand what IBS is, what it is not, and when it is time to see your own doctor.
All right, let's start from the beginning. Doctor, in simple words, what is IBS?
IBS, Irritable Bowel Syndrome, is a long-term problem with how the gut works, not how it looks. People with IBS have repeated stomach pain or discomfort, plus changes in their stool. Sometimes they go too often, sometimes not enough. Sometimes it goes back and forth. We usually talk about three main patterns: IBS with constipation, IBS with diarrhea, and IBS with mixed type. These symptoms stay for several months, not just one bad week. When we do tests, we usually do not see bleeding, ulcers, or damage. It's a sensitive gut and a strong gut-brain connection, not a broken intestine.
So, it is common, not strange. How common is IBS? Is it something rare or many people have it?
Many people have it. Across different countries, a good number of adults live with IBS symptoms. A lot of them never get a formal label. They just say, "My stomach is always sensitive." So if this sounds like you, you're not alone, and you are not weak.
People will ask, why me? Why does IBS happen?
There is no single your fault reason. It's usually a mix. The nerves in the gut are more sensitive, so normal gas or movement can feel painful. The muscles of the bowel may squeeze too fast or too slow. The brain and gut talk too loudly to each other, especially with stress or poor sleep. Some people develop IBS after a strong stomach infection or food poisoning. Hormones, certain foods, changes in gut bacteria, and mood can all play a role. It's real. It's not just in your head. But it's different from inflammatory bowel disease, ulcers, or cancer.
Okay, so if someone is listening and thinking, maybe this is me, how do doctors actually check for IBS?
First, we listen to your story. We look for a pattern. Stomach pain that keeps coming back, often linked to going to the toilet, with changes in how often you go and how your stool looks, for at least a few months. Then, we make sure nothing serious is hiding. A doctor may do blood tests, stool tests, or other checks. If you're older, or if there are warning signs, they may suggest a colonoscopy or more tests to be safe.
Let's make that very clear. What are the warning signs that are not typical for simple IBS?
Please do not just call it IBS if you notice blood in your stool, unplanned weight loss, fever, severe pain that wakes you at night, vomiting that doesn't stop, new symptoms after age 50, or a strong family history of colon cancer, inflammatory bowel disease, or celiac disease. If you see any of these, get checked properly. Do not wait.
All right, so let's say tests are normal and the doctor confirms IBS. What can people do? How do we manage it in real life?
The goal is simple. Fewer symptoms, better gaze. First, understanding. Knowing IBS doesn't damage the bowel and it doesn't turn into cancer helps calm the fear. Next, food. Many people feel better with regular meals, less greasy and fried food, fewer fizzy drinks, and fewer highly processed snacks. Some people need guidance from a doctor or a dietitian to learn which foods trigger them. Then fiber and fluids. Some people with constipation-type IBS feel better with gentle, soluble fiber and enough water. Others need a different plan, so it must be personal. Lifestyle also matters. Good sleep, daily light movement, and simple stress tools like walking, breathing, or talking with someone can calm the gut-brain connection. And medicines. Doctors may give medicine for cramps, diarrhea, constipation, or other targeted treatments when needed. These are chosen for you. Not every IBS patient needs the same pill. Please do not copy medicine from friends. Always follow your own doctor.
People worry, will this destroy my gut? Can it turn into cancer?
That is an important question. IBS itself doesn't cause permanent damage, and it doesn't turn into colon cancer or inflammatory bowel disease. The bigger problem is quality of life. Pain, urgent toilet trips, fear to travel, fear to eat outside. So we take your symptoms seriously, but we also give reassurance once serious causes are ruled out.
What about complications in daily life? What can IBS do to someone's mind and routine?
People may feel anxious, low, or embarrassed. They may avoid trips, meetings, or social events because they're scared their stomach will act up. Some try very strict diets and many medicines without guidance and end up weak or more uncomfortable. So, good IBS care also means emotional support, clear information, and follow up with a doctor who listens.
For someone asking, what can I do myself? Is there any way to reduce IBS flare-ups?
Yes, there are helpful habits. Eat regular, simple meals instead of huge, heavy ones. Notice your own triggers and gently reduce them with support, not fear. Move your body most days. Even walking helps. Sleep enough hours. Handle stress in healthy ways instead of smoking, heavy alcohol, or skipping meals. Treat stomach infections properly and drink enough fluids. These steps may not cure everyone, but for many people, they make a real difference.
Doctor, for the person watching this and thinking, this sounds like my life, what would you say?
I would say you are not alone and you are not imagining it. If you have ongoing stomach pain plus changes in your stool, get checked. If tests are normal and it's IBS, don't panic. Work with your doctor on food, lifestyle, and medicine if needed. And if you ever see red flag signs like blood, big weight loss, fever, severe new pain, or a strong family history of serious gut disease, please get checked again. Do not just say, it's only my IBS.
Thank you, doctor. And to you watching, this video is for education only and not personal medical advice. If you have stomach problems, please see your own doctor or local clinic for a safe, personal plan. Thank you for watching Dr. Health Hub. Your health is your wealth. Stay tuned for the next doctor tip you can trust.